I'm Joe Chili, weekdays 7 to 9 a.m. on Buffalo's oldie station, the Big Weck. On Buffalo on the Rise today, we're pleased to have with us Danielle Bergman, who is the Executive Director of the VA of Western New York Healthcare System. How are you today?
I'm great, Joe. Thanks for having me.
Well, we're glad to have you. Now, you were just sworn in on Monday.
I was.
So, we're in the first week for you. How did things change between how you were working? What were you doing previously to be?
I was previously the Assistant Medical Center Director at the VA.
Okay. So, big difference? Little difference?
I would say probably medium difference, if
Really?
you would. Yeah, so it's a facility that I've known for a long time. I know the veterans there, I know the staff members. So that has not necessarily changed. Just now getting involved more in some clinical side of the house as opposed to the operations side.
The question that I'm sure everybody that's watching wants to know right now is, do you have your own parking place?
I do have my own parking place, yes.
Okay, so now that we've got past that, we've heard that the VA is a world-class facility. And, how does the local VA differ from other competitors, if you will, in the community?
Yeah, so that's something we take really seriously, whether it's at National VA or here in Western New York. We take providing world-class healthcare to veterans who've earned everything that we provide incredibly seriously. We provide a lot of fantastic benefits, whether it's primary care, specialty care, mental health. We run the gamut, and so it's something that is near and dear to all of our hearts in Western New York and at the VA, and we take no greater pride than being able to serve veterans.
Is it kind of like a one-stop shop?
It is, absolutely. So one of the great things that I didn't realize before coming to the VA is that a veteran can literally come in and do a whole slew of appointments with one copay. So they can go see their primary care provider, and if the primary care provider says, I'd like to see some labs on you, they just go across the hall to the lab and get their labs drawn. And maybe that primary care provider wants to get a CAT scan or an x-ray, they can go up to radiology and do that. They can also go see their endocrinologist, or they can go see their physical therapist, all right in our building.
Now, when I think of the VA, I think of here in Batavia, is it? Yeah, what makes a determination on where you go? Is it just where you live or where you're assigned? It's
the preference of the veteran.
Is it?
Yes, so if a veteran wants to come to Buffalo, they can come to Buffalo. If they live closer to the Batavia area, they can go there. But we also have 7 community-based outpatient clinics. So we cover literally Niagara Falls all the way down to Olean. And we would welcome a veteran at any of our facilities.
That was going to be my next question. If it was an individual that was aged or whatever, and they had a hard time as far as transportation is concerned, can you help out in that regard? Absolutely.
So there's probably a VA close to them rather than having to come to the big hospitals in Buffalo or Batavia. But then also we have other benefits that veterans may be eligible for, including transportation options.
I think that the Veterans Administration has come a long way. I mean, I'm of Vietnam era. And I think that, I remember back in those times, I've had friends that come back that were on long waiting lists to have things done. And, we started talking about Agent Orange and burn pits and things like this, that brings it closer to current time. But that has really changed. The VA has really, I don't want to say that it's changed. It was always basically what it is, but it's gotten much more attentive to some of these things, right?
It has. So our Secretary Collins, has challenged us to think about things in a different way. And his #1 priority that he's laid out for us is putting the veteran at the center of everything that we do. So making sure that the decisions we make, making sure that the policies or processes that we have in place are to benefit the veteran. One of those things that we look at is we look at wait times. So we try to get veterans in, depending upon the specialty, either 21 or 28 days. If we can't see you in less than 28 days, we're going to talk with you about potentially looking at care in the community where we would pay for you to go see a specialist in the community.
All right. Tell us a little bit about telehealth.
Okay. Telehealth is one of those things that VA has been pioneering for quite some time. It really took off during COVID because people didn't necessarily want to come into a big hospital, and so we offered a lot of telehealth during COVID. But we've continued to grow on that success. So if you're a veteran and you'd feel more comfortable attending an appointment at your home right from your couch, you're absolutely able to do that. If it's late at night and you don't want to go to an urgent care center or an emergency room and you want to talk to a physician, you can also do that. We have something called the Clinical Contact Center that's open 24/7. You can talk to a pharmacist if you have questions about your prescriptions or need a refill. You can talk to a nurse, emergency provider, and or schedule appointments.
You know, you mentioned to me prior to going on the air that you started at a different VA. What's the relationship, or is there a synergy among different VA hospitals in different parts of the area or the country?
Yeah, so we call them networks, and so we are a part of VISN-2, which is the network for upstate New York and New Jersey. And that VA that I started at was the Finger Lakes, and so they are a sister site for us. And so we work together to be able to provide services. Sometimes that means that we provide teleservices to their veterans who might need cardiology care, and they don't have a cardiologist on staff at that VA. Sometimes it's you need a transplant, and we have a transplant center downstate in New York City. It kind of just depends, but we utilize our resources together to be able to serve veterans.
That sounds great. I mean, I think the fact that the Veterans Administration has really worked hard at working for some people that are very important to us, you know, in what we do every single day. I mean, some of us don't think about, you know, what veterans have actually given us, unless, of course, we've had parents or we've served ourselves. But we commend you on what you do. And congratulations once again to Daniel Bergman on your appointment.
Thank you, I appreciate that.
Very nice. For more information about the VA Western New York healthcare system, you can go to va.gov and find a location with your zip code or call 716-834-9200. Sponsorship and promotional consideration for the preceding segment was provided by the VA Western New York healthcare system. And don't forget to join all your favorite personalities, JP, Roger, Christian, Bobby O, and me with classic oldies from the 60s and 70s on the Big Wack.